Hi, Maria. My name is Lydie. I'll be taking care of you today. Looking at your iron studies, I think you have a condition called iron deficiency anemia. This condition occurs when the iron supplies in your body decrease below what your body needs. Typically, you get your iron, which is very important for blood development, through dietary sources like animals and plants. Then the iron is absorbed through your stomach, and then it goes into your liver, your macrophages, which is a type of cell in your body. And that's what helps make your blood in a normal circumstance. Genetics can also play a role in iron deficiency anemia. They found as many as 19 different genes that can increase your risk for IDA. Now, this disease actually starts, like I said, when the iron supply in the body falls below what it needs. There are 3 different stages. You are in the 3rd stage, which shows that your iron studies are low, your blood counts are low, and you are having symptoms. This happens through a few different ways. Like we talked about, this could be decreased iron intake, likely dietary, because some people follow a vegetarian diet, or decreased absorption, like your stomach's not working, through things like Crohn's or celiac disease, or chronic blood loss, which is what's going on for you. This chronically low intake or loss leads to low iron supplies through low ferritin and low iron studies, which leads to decreased blood cell production. And the blood cells that you do have are smaller and they carry less oxygen, which drives your symptoms. Because we already have your iron studies resulted, your ferritin level is below 15, which gives us a 99% accuracy in your diagnosis of iron deficiency anemia. We do need to do a couple more assessments, though, just to rule everything else out. Do you have any medical history of conditions like Crohn's, celiac disease, or do you use alcohol? Have you had any bloody or dark stools? Have you had any abdominal pain? Have you had any unusual amounts of blood loss? What kind of diet do you follow? Do you eat red meats, leafy greens? Do you have a family history of anemia or clotting disorders or any other blood conditions? Finally, can I look at your stomach? I'd like to listen to it and touch it as well. The abdomen is a very likely source of bleeding. And if we find anything in these assessments, we might need to order some additional diagnostic tests. Those could include a blood smear, a CT scan, or ultrasounds. Now your plan. Since we know what's causing your anemia, which is your heavy periods causing chronic blood loss, I would like to start you on a hormonal birth control to lighten your cycle, and I'd like to refer you to an OBGYN. Until your birth control is effective, you need to use other contraception to avoid a pregnancy at this time. We need to get your anemia treated before you were to have a baby. Then I would like to start you on oral iron. I'm going to prescribe you Ferritin, 150 milligrams, until your blood counts normalize. You're going to take it every day. And then you're going to take it 3 times a week for 6 months after that. While you're on this iron, it could make your stools bloody, or not bloody, I'm sorry, dark and tarry, and it might taste bad. I need you to let me know if you start having stomach pain with it or nausea and vomiting. Then we need to talk about your diet. I would like for you to incorporate red meats and leafy greens. When you're eating these iron-rich foods, try to avoid things like coffee, tea, and milk. Those can hinder iron absorption. Try to eat foods high in vitamin C because those can help. I would also like you to keep a food log. I want to make sure you're eating enough iron-rich foods to help treat this anemia. I would also like you to get labs in 5 weeks so that when you come back to see me in 6 weeks, we'll have results and we'll make sure you're getting better. I need you to come back sooner if your symptoms are getting worse. They won't get better for a couple weeks after we start the iron, but I don't want them getting worse. Call the office if you are having worsening symptoms. I need you to seek emergency care. If you are menstruating through more than 1 tampon per hour, you're having shortness of breath, chest pain, new weakness, or you pass out. Make your follow-up with an OBGYN as soon as you can. I am placing an urgent referral. Call me with any worsening symptoms.